Next up, we've got something a bit different. We've got Pat here to speak, who did his internship in community, but is now working in hospital pharmacy.
Okay. My name's Patrick. I'm a pharmacist out at Westmead Hospital, the adults hospital, not the children's, which is one of the bigger hospitals in the state, and it's a really great hospital to work at. Now, about me, I'm unremarkable. You know? I was not a fantastic student. I got through, I did okay, I had a lot of fun. But there was nothing remarkable about me. I didn't do honours, I just did the normal pharmacy degree, and when my intern year came along, I did it in the community pharmacy that I'd been working at for the 4 years of my degree. And then it was after that that I decided I'd like to try hospital. So I suppose I'm here because if you look around, there's far more of you than there are intern jobs in hospital. But getting an intern job in hospital is not the be-all and end-all, so don't panic if you don't. So what I did when I decided that I wanted to sort of start working in hospital is first start calculating when I'd be finishing my hours in the community, just to know when you will be registered, so that you have a bit of an idea. And you know, I started applying for jobs well before those hours were complete, because you know, I had in my head I could tell them the time when I would be registered, and you know, that was the aim for the start date, I suppose. The biggest piece of advice I can give you when applying for these hospital jobs, and Aaron's already said it, is answer the advertised job selection criteria. Because at the end of the day, if a hospital gets 20, 40, 100 letters, all the letters are going to be pretty similar. It's the way that you answer those selection criteria that I think would really make a difference on sort of whether or not you do get the positions. So I suppose I just want to run through some selection criteria that I had when I was applying for pharmacist jobs. So these will be different from intern criteria, but they are still relevant, and I just want to show you that, you know, they're generic skills for a pharmacist. So it doesn't, as I said, it doesn't really matter if you've worked in a hospital before or not. These are generic skills. We should all have them. So good clinical knowledge is a criteria that comes up a lot. So, I mean, community pharmacist, you've just been registered, you should have good clinical knowledge because there's no other way you would have got through. Ability to communicate effectively, verbally and in writing. Again, it's a generic skill. You've just got through uni as well as your intern year. You should all be able to write and speak. Demonstrated commitment to professional development. Again, really easy, especially after your intern year, because you have to. You know, it's a no-brainer. Everyone should have a commitment to professional development. The things that can get you across the line in terms of that criteria, I think, are being a member of the Hospital Pharmacy Association, the SHPA, because, you know, something like that is going to give you an edge over other people that haven't worked in hospital before and are applying for the same job. Problem-solving skills. You know, if you work in community pharmacy, you have people coming in off the street with all sorts of problems, and you're helping solve them for the people. So, you know, that's a problem-solving skill that you're doing every single day. Clinical reasoning skills. Again, when you're counselling somebody in a community pharmacy that's coming off the street with a problem, you're sort of working through it clinically. So it's something that you can sort of talk about if you have worked in community exclusively, as I have. So some more criteria. Familiarity with pharmacy dispensing and other relevant computer software. Hospitals use a different pharmacy system from what people use in the community, but it's a similar sort of idea. And you know, you can talk about your experience with the systems that you have, and that shows that you are able to sort of work with other systems. You know, it's something that you can answer, even if it does look a bit intimidating. Proven ability to supervise and direct the activities of support staff. Every pharmacy will have shop girls or, you know, other pharmacists in there that you can sort of supervise and direct, because that's your job as an intern or a pharmacist. You know, they're generic skills. Proven time management skills. Any pharmacy is busy. You work with that, you work around it. It's a generic skill. This is one that at first I had a bit of trouble answering, sterile and cytotoxic manufacturing, but its ability to participate. So the way that I went about answering a question like that is show some enthusiasm. I went onto the SHPA website and they have guidelines for sterile and cytotoxic manufacturing. Read them. Work that into your answer. Say that you're really keen to learn. Proven patient-focused practitioner with an interest in counselling. You know, if you counsel patients, it's a skill that you use in hospital as well as community. If anything, you probably use it more in community. So they're easy things to answer. Some of the harder ones that I found, because I hadn't actually worked as a pharmacist when I was applying for these jobs, I felt a bit uneasy about dispensing and checking prescriptions because, you know, as an intern you're always supervised. But, you know, showing an enthusiasm and sort of the process of checking when you are answering the criteria can really help. And the supervision again of the non-professional staff as well, so the people in the shop. You know, these are things that you need to do in hospitals as well, because you do have technicians, you have storemen working in the pharmacy, you have all sorts of different people. So they are generic skills, so don't panic. Just in summary, it's the same core skills in hospital and community, so there's no real reason to panic if you don't get the hospital job. There is the opportunity later on. I'd applied for 2 hospital jobs while I was not yet registered, and you know, I know that there were other people applying for them that did work in hospital in their intern year. I got offered both of them, so it's not, you know, a hospital intern is not a prerequisite for any hospital job. Hospitals are always willing to teach. You need to learn when you are in a hospital because, you know, there's so many different clinical specialties, there's no way you'll ever know everything. So, you know, they expect to have to teach people when you do get there. And the SHPA, through its education programs, does give you a big leg up. I personally didn't attend any SHPA in my graduate. I wish that I had, because it would have made the transition from community to hospital a lot easier, and you know, the exposure that you get to different areas of practice by going to the SHPA education evenings is just immense. So that's everything.
Thanks. So it's good to see there are other routes into hospital pharmacy other than doing your internship there. So next up, we've got the perspective of the directors. So these are the people who in part will choose who gets the actual intern position. So first up is Peter Barclay, who is the Director of Pharmacy at the Children's Hospital in Westmead.
It's really good to see so many people who are excited about hospital pharmacy, because really, you know, this is the generation that's going to, you know, carry on our work. So it really is, you know, very exciting for us, you know, as professionals to know that, you know, the future's bright. And in the past, Terry would agree that quite often we would have positions that we couldn't fill. And we know now that's not going to happen in the future. For various reasons. But still, everything that's been spoken about is very true, because the sort of people that we want to work in hospitals are those that are keen, patient-focused, and they want to learn. We don't want people coming to hospital that are incredibly academic and can't talk to a patient, or don't have the skills to solve a simple problem that you'd probably be doing on a prac during your 4th year at uni. So we need practical people. We need people who are going to learn those skills and have the ability to communicate to other people. So when you are doing your letter, you know, sure, as everyone says, address the criteria, because I had 90 applications for my 2 jobs last year, and only about 50% addressed the criteria. So that was easy. Those 45 could go in one pile. But there was another group that didn't have the right hospital on the day, so that's another big part. But the rest are very hard to differentiate between, because you've all got the same sort of skills, you've got the same degree of education, so how do we pick the differences? So you address the criteria, you tell me about yourself. So someone asked before, should I give any non-pharmacy ideas? Or, you know, have some thoughts about what you've achieved in your life. That's very important. I don't like, personally for my hospital, to say, oh look, I love children. In general, that's a good concept. But I don't want people to come to work to play with kids. We have work to do. So, but, you know, certainly if you've been a leader of, you know, some sort of church activity, or you've been an organiser of things, you know, you may have organised the softball, you know, for 5 years, and, you know, that demonstrates a lot of skills, yeah, that you've got, you know, the ability to volunteer, you've got leadership, you've got organisational skill. So that's useful to know. And when, as Pat was saying, you know, if you have been to some SHPA or some education functions, it gives us an idea that, oh, look, you know, this person's thought about their career. They've thought about where they want to be in, you know, maybe 3-5 years. These are the sort of things that they want to achieve. So I can start to see, oh, this person's, you know, they're starting to think about, you know, they can go onto this SHPA website and say, oh yes, there's introductory, you know, clinical pharmacy. I'd like to do that in my graduate year, or I plan to do these sort of things. I even know about the Masters of Clinical Pharmacy, and just think, you know, I've been thinking about the direction I want to go. We understand too that people may not want to decide I'm going to be in the hospital now for the rest of my life, but certainly as a director of pharmacy, I know that if any of you work in hospital for 3 to 5 years, you'll be able to do just about anything in terms of the healthcare industry, because you'll have so much background. And you have to be willing to learn, because when you're in that hospital environment, every opportunity, whether you're doing, you know, DDs for, you know, almost a day straight, or whether you're in inpatients checking, or whatever you're doing, you'll be exposed to hundreds of items, different doses, different things which you're not going to see in the community setting always. Lots of opportunities to talk to doctors, nurses, and even participate, you know, in the management of patients. And lots of ways it's a real privilege, and just it's a lot to learn. So I always tell the interns, have a little notebook with you, because you'll be able to write things down and, you know, fold it up later, because it's a great opportunity in hospital to learn, because that's what, you know, being a pharmacist is about. It's not just getting a degree, getting your registration. It's continual, you know, professional development for the rest of your life. And someone that can demonstrate to me that's what they're about, you know, that's what I'm looking for. And as Erin said, it's very hard to pick between, you know, the people. We had 12 interviews from around 90, and Erin was one of them. I could have easily taken any of those 12 people, because they were all of such high standards. So in the end, you're picking between people, you know, as Sarah said, it might have been the way that she did her the demonstration of how to use a syringe, or it may have been the fact that they, you know, were better with the medication chart. So it can come down to very small things. But certainly, you know, that sort of, the ability then is to go away and say, look, you know, I didn't get this job, but I'm still going to go for the hospital in the future, you know, I think is great, because, you know, we know we don't have enough positions for everyone here in the room, but we know that, you know, in our healthcare system, we're hoping to make more and more jobs for pharmacists, sort of in that kind of transition from hospital to home. So maybe in the future we'll be looking at more, you know, working not just traditionally in the hospital space, but in that, you know, getting out into the community. When I've spoken enough, I'll get Terry to put her input in as what she'd like to see in the interview.
Okay, like Peter, I've